class, I have the disease process of edema. Edema is the evidence of excess fluid in the interstitial compartment that results in swelling or enlargement of the tissues. The pathophysiology is that edema has 4 general causes. The first one is the increased capillary hydrostatic pressure. So think of like a higher pressure within the blood vessels that prevents the return of fluid back into those tissues, or forces out the excess fluid from the capillaries into the surrounding tissue. Things like pulmonary edema, dependent edema, and angioedema are some items of that first cause of edema. And interestingly, when I was doing my research in the pathophysiology, there was a new development related to COVID and prolonged intubation of patients causing specific edema just at the tongue. The second cause of edema is loss of plasma proteins in the blood, more specifically albumin. So albumin and kind of the plasma protein has a lot of fluid consistency. So the albumin loss proteins in the urine with kidney disease, liver disease, malnutrition, malabsorption. The third cause of edema is the result of an obstruction of the lymphatic circulation that causes more localized edema. And that obstruction may be a tumor or damage to the lymph node related to infectious process or surgical removal. Sometimes as we see this as lymphedema with patients who may have had breast cancer and had their lymph nodes removed. It can also occur in something called subclavian steal syndrome, where the subclavian vein is pressed against the clavicle and it creates an obstruction, resulting in edema to one side of the arm, typically the left arm. And then the fourth cause of edema is increased capillary permeability. So think of it as our capillaries have all those small fenestrations in them to be able to make those exchanges. And that's the localized edema, which can result from an infectious process or an inflammatory response after an injury to the tissues, such as a burn. Risk factors for edema include heart disease, liver cirrhosis, pregnancy, pulmonary hypertension, kidney disease, a reaction to medications, bacterial toxins, severe injury to bone or tissues, surgical removal of the lymphatics, and post-surgical fluid volume overload, or something that we call anasarca. Some images that I found from the Mayo Clinic show the edema here. This is dependent edema, which is found with right-sided heart failure patients. And there's an example of pitting edema, which is where you actually push on the skin that is swollen and it leaves a pit there. And there's a measurement process for that called +1, +2, +3, +4. And there's also firm edema that does not pit. And second example of edema in a picture is ascites. That's a buildup of fluid around the liver when you talk about liver disease and liver failure. It can also be directly related to that plasma protein albumin. Oftentimes patients that have liver disease have low albumin levels. In addition to having a paracentesis to help forcefully remove that fluid, we can also sometimes shift those fluids in a liver patient by giving them albumin back into the bloodstream, and it helps to create that shift of fluid. So diagnostic testing for edema is going to be dependent on the physical findings and the possible cause of the edema. So if you have localized swelling, is it pitting or is it firm? Does this patient also have heart disease? Do they have weight gain? Is it dependent edema in the feet and ankles if their legs are down, and does it kind of resolve if they elevate their legs? Dependent edema can also be seen in the advanced third trimester of pregnancy. So some of the causes of the edema would then lead you to the correct diagnostic testing, which would likely include blood draws, looking for electrolyte imbalances, changes in the hematocrit and hemoglobin. So it would be a BMP, a CBC, a MAG, FOS, checking an albumin level if that patient has malabsorption, malnutrition, or any kind of liver disease, a proBNP, which speaks specifically to a cardiac enzyme, which can be indicative of right-sided heart failure, and then a urine osmolarity, which will also indicate if there's any kidney disease there as well.